Hello, my name is Paul Pavia, and I am a manager in the healthcare and human services industry at Feeley Driscoll in Boston, Massachusetts. On this webcast, I will discuss the importance of physician time studies and the criteria necessary to properly complete them. For more information on this topic or other topics, please visit our website at www.fdcpa.com or contact us at 888-875-9770. Physician time studies are used on the Centers for Medicare and Medicaid Services, or CMS, 2552 cost report filed by CMS certified hospitals and hospital healthcare complexes. Physician time studies serve as the basis for allocating physician compensation between allowable and non-allowable costs on Schedule A82 of the CMS 2552 cost report. The extent to which a hospital accurately captures physician compensation on Schedule A82 has a direct impact on its reimbursement from CMS. Incomplete or inaccurate physician time studies can result in the disallowance of physician compensation on Schedule A82 upon an audit by CMS. Before I review the criteria for acceptable physician time studies, it is important to understand the meaning of physician compensation according to CMS. As defined in the Code of Federal Regulations, Title 42, Public Health, Part 415, physician compensation costs are monetary payments, fringe benefits, deferred compensation, and any other items of value, excluding office space or billing and collection services, that a provider or other organization furnishes a physician in return for the physician services. Each provider that incurs physician compensation costs must allocate those costs in proportion to the percentage of time that is spent in furnishing services to the provider, known as Part A, services directly to patients, known as Part B, and other activities of the physician that are not payable under either Part A or Part B of Medicare, such as funded research. Only costs allocated to payable physician services to the provider, Part A, are allowable costs to the provider. Generally, the total physician compensation received by a physician is allocated among all services furnished by the physician unless 1. The provider certifies that the compensation is attributable solely to the physician services furnished to the provider. 2. The physician bills all patients for the physician services he or she furnishes to them. And 3. The physician personally receives the payment from or on behalf of the patients. The Medicare Fiscal Intermediary pays the provider for physician compensation costs only if the provider submits to the intermediary a written allocation agreement between the provider and the physician that specifies the respective amounts of time the physician spends in furnishing services to the provider, Part A, services to patients, Part B, and other activities of the physician that are not payable under either Part A or Part B of Medicare, such as funded research. The compensation must also be reasonable in terms of the time devoted to these services. In the absence of a written agreement, the intermediary assumes that 100% of the physician compensation is allocated to services to patients, Part B, and therefore are non-allowable costs. Each provider that claims payment for services of physicians must meet 3 requirements. Maintain the time records or other information it used to allocate physician compensation in a form that permits the information to be validated by the intermediary or the carrier. Report the information on which the physician compensation allocation is based to the intermediary or the carrier on an annual basis and promptly notify the intermediary or carrier of any revisions to the compensation allocation. Retain each physician compensation allocation and the information on which it is based for at least 4 years after the end of each cost reporting period to which the allocation applies. The intermediary may adjust limits on compensation for physician services to account for costs incurred by the physician or the provider related to malpractice insurance, professional memberships, and continuing medical education. Now that I have described physician compensation and the requirements for claiming these costs on the CMS 2552 cost report, I'll explain the criteria that must be met in order for periodic time studies to be used to allocate physician compensation. 1. The time records to be maintained must be specified in a written plan submitted to the intermediary no later than 90 days prior to the end of the cost reporting period to which the plan is to apply. The intermediary must respond in writing to the plan within 60 days from the date of receipt of the request, whether approving, modifying, or denying the plan. 2. A minimally acceptable time study must encompass at least 1 full week per month of the cost reporting period. 3. Each week selected must be a full work week. 4. The weeks selected must be equally distributed among the months in the cost reporting period. For example, in a 12-month period, 3 of the 12 weeks in the study must be the first week beginning of the month, 3 weeks must be the second week, 3 weeks must be the third week, and 3 weeks must be the fourth week. 5. No 2 consecutive months may use the same week for the study. For example, if the second week beginning in April is the study week for April, the week selected for March and May not be the second week beginning in those months. 6. The time study must be contemporaneous with the cost to be allocated. Thus, the time study conducted in the current cost reporting year may not be used to allocate the costs of prior or subsequent cost reporting years. It is suggested that the time study include a statement that adequate controls are in place to collect time studies throughout the period. 7. The time study must be provider-specific. Thus, chain organizations may not use a time study from one provider to allocate the costs of another provider, or a time study of a sample group of providers to allocate the costs of all providers within the chain. Physician time studies do not require the maintenance of daily logs or time records to support provider services rendered by physicians. However, adequate documentation must be maintained to support the total hours for these services to permit the application of the reasonable compensation equivalent limits. Adequate documentation includes work or teaching schedules, workload counts, or other documentation to substantiate these hours. Where providers decide to employ time study techniques to substantiate the allocation of physicians' times to service or the actual provider service hours used in the reasonable compensation equivalent computation, the provider may choose to use the previously described methodology. However, the fiscal intermediary may not require the provider to use this specific methodology. As an example, National Government Services, a Medicare intermediary, recommends a minimum of 2 weeks per quarter for physician time studies. CMS publishes examples of physician time studies that are acceptable for allocating physician compensation on Schedule A82. These exhibits serve as good examples of what is required by CMS, but you may find it is easier to obtain this information from your automated software systems. Exhibit 1 is from CMS Publication 15-1, Subsection 2182.13. On line 1, indicate the name of the provider's Medicare identification number, and the provider department. Indicate the name of each physician or the name of the physician group if there is an agreement between the head of the physician group and the hospital, and the allocation agreement is a departmental allocation agreement, i.e. it applies to all physicians in the department. On line 2, indicate the basis for the allocation agreement, whether it is based on an estimate, time studies, or other factors. On line 3, indicate the total actual hours that the physician or physician group works per week. On line 4 and line 4A, indicate the percentage of total time the physician or physician group spends in the various listed activities. Add these individual percentage amounts and list the amount in the total block. On line 4B, indicate the percentage of total time the physician or physician group spends in furnishing medical or surgical services to individual patients. On line 4C, indicate the percentage of total time the physician or physician group spends in non-covered Medicare activities such as research. At the bottom of the exhibit, the provider's representative and one physician or the head of the physician group signs and dates the agreement. Exhibit 2 is from the CMS Provider Reimbursement Manual, Part 6, Subsection 1102.3G. While I will not walk through this exhibit line by line, the objective of this exhibit is to furnish a reasonably accurate delineation of activities on the basis of an average work week. The data elements shown are physicians' hours of service, providing a breakdown between the professional and the provider component for intermediary and carrier use. You would prepare a physician time allocation for each physician by department who receives payment directly from you or a related organization for services rendered. This includes physicians paid through affiliated agreements. However, Exhibit 2 does not have to be completed for physicians whose services are exclusively direct patient care and whose total compensation has been eliminated from the cost report. A weighted average for the entire department may be used where all physicians in the department are in the same specialty. Where a weighted average is submitted, individual time allocations need not be submitted. The physician or department head supplying this information must sign the schedule. I hope this summary of physician time studies was useful to you and your organization. Physician time studies can be overlooked, and providers may be missing out on physician compensation that could be reimbursable on the CMS 2552 cost report. It is important to at least consider if your provider uses physicians for Part A services and whether physician time studies will be needed to support the allocation of physician compensation on Schedule A82 of the CMS 2552 cost report. Again, I am Paul Pavia, a manager in the healthcare and human services industry at Feeley Driscoll in Boston, Massachusetts. Thank you for your time, and should you have any additional questions, please feel free to contact us at 888-875-9770 or visit us on the web at www.fdcpa.com.